Welcome to this International Confederation of Midwives webinar on Midwives and Leadership. I'm Sally Pairman, the Chief Executive of the International Confederation of Midwives, and it's my privilege to moderate this webinar this afternoon. This is the third in our series of 4 global dialogues, our Stronger Together webinar series, where we are focusing attention to different areas of midwifery in order to gain key insights from key groups that can inform our work to strengthen midwifery in order to and improve services for women as we enter the decade of the midwife. By listening to the personal experiences of our participants, we will better understand current challenges and priorities for the future. And as you are coming into this webinar, please do make sure that you have downloaded the Interprify app to your telephone so that you can listen to this webinar in French and Spanish. And if you need instructions, you can find those on the chat. So please do use Interprify, it will make it so much easier for you. Also, as we begin, I want to ask you all to please put into the chat where you come from so that we can see where everybody is from and the diversity of people who are here. So also tell us, are you a midwife? Are you a new mother or a pregnant woman or a student midwife or somebody from a partner organisation? Let us know a little bit about you. Thank you. We've got a fantastic panel of 4 women leaders whom I'm briefly going to introduce. I'm going to be asking the panel a series of questions and encouraging a conversation between panelists over the next hour or so. But you can also participate by putting your questions into the chat, and we're going to keep some time aside towards the end of the session to give your questions to the panelists. So please do send through your questions. And it's wonderful to see so many people coming in already from, goodness me, the Philippines, from Somalia, from Peru, from Germany, from Canada, from Australia, goodness, in the middle of the night, from Gambia, Aruba, Turkey, Portugal, the UK, the Netherlands, Scotland, France, the Caribbean. How utterly amazing this is, isn't it? So incredible that COVID has given us, in a way, this gift of all being able to connect like this and see each other from all around the world to talk about midwifery. Our shared passion, I'm sure. Switzerland, India, Uganda, Belgium, another UK, South America, the Philippines, Sydney, Uruguay. Too many for me to keep calling out. But I'm going to introduce you now to our panel. We have with us Professor Jacqueline Dunkley-Bent, who's the Chief Midwifery Officer for the NHS in England, the National Health Service in England. She has an extensive career in midwifery and has held numerous senior positions in midwifery practice, education, leadership and management, a very well-rounded midwife. She's highly regarded midwife leader, and in 2020, she was named as one of the most influential individuals in healthcare in the United Kingdom. We also have Gondwe, the Programs and Advocacy Manager for the White Ribbon Alliance in Malawi, another very well qualified and experienced midwife. Iya has a passion for ensuring that women and girls know their rights and responsibilities in reproductive health services. And she's working really hard to engage women and girls to advocate for improved health services and better outcomes for themselves and for others. We also have Franka Cadée, the President of the ICM, now in her 2nd term, and a president of whom we are all very proud at the ICM. Based in the Netherlands, Franka has more than 30 years of practice across many aspects of midwifery practice, including home birth, policy, advocacy, research, and project management. Franka recently achieved her PhD for her research into twinning as a cross-cultural reciprocal process to strengthen the agency of midwives. And last but not least, we have Giorgia Cartes Bravo, the world's newest chief midwife, and only the third that we know of. Giorgia comes from Chile and has spent much of her career working in a gynecology and obstetrics unit in a public hospital in Santiago. On the 1st of September 2020, she assumed the new role of Chief Midwife of Chile, where she is going to be working hard to strengthen midwifery and improve reproductive health services for women and newborns. So we have a fantastic panel, all amazing leaders, and I know they have much to share with you all today about leadership. So we're going to kick off with the first question. And I think I'm going to start this with Iya, because I'm not sure, Giorgia, have you got your Interprify working? Just, can you give me a thumbs up if you have? Okay, I think I might leave Giorgia till the end, just in case. So Iya, let me start with you. And I wonder if you could tell us what you think when we talk about midwives and leadership. What does it mean to you? What do you think about when you talk about midwives and leadership in the same breath?
I think midwives have a great opportunity to lead in various organizations in different roles in the world globally, to assert the influence in certain policies that affect us worldwide. But at first and foremost, midwifery itself as a profession has to be recognized as a distinct profession, which in this case, in several countries across the globe, is not the case. In Malawi, we have the same challenges where nursing and midwifery is combined, and you really can't impress yourself on issues that are affecting the midwifery profession because we don't have a specific office tackling midwifery issues in country. So I feel like midwives need to be able to define their role and responsibilities, to be able to know that they have a place where they can go to assert certain issues that are affecting them in their workplace and how they deliver care to mothers and newborns in the country. So yeah, we need a distinct, we need to start talking about how midwifery can be recognized as a profession on its own, apart from being attached to the nursing profession itself.
And yeah, can I ask you, I mean, how do you think that midwifery leadership can influence that, recognition of nursing and midwifery as separate but distinct professions? I mean, what would you think would be the sort of leadership role within that?
Okay, so first and foremost, in Malawi, we have the Directorate of Nursing and Midwifery Services in the country. But before that, previously, we used to have the Directorate of Nursing Services. In Malawi, we had to fight for that so that we have a component, the wording itself to be nursing and midwifery services. So that was the first win. Second and foremost, we had to make sure that we have positions established in the government system where there's a clear career path for the midwives. And so recently, just recently, we've won on that, where we now have the Chief Midwifery Officer in the central hospitals, as well as Principal Midwifery Officer in the central hospitals. We know that it will trickle down to the district hospitals once they undergo the functional review. However, we don't want to stop there. We want them, our midwives, to be in the leadership positions where they can influence policy change, they can speak out and demand for various services that are supposed to be entitled to, for them to do their work properly. And now we're going further to demand for the position of the Director of Midwifery Services in country. So that's where we're heading to. But at the moment, we're still trying to fight that our country has those positions established. And it's going to take a lot of advocacy. But if we've been able to achieve the positions of the Principal Midwifery Officer as well, the position of the Chief Midwifery Officer, which in the past we couldn't even dream of having such kind of positions. we believe that we can also attain this. And we know that with that, we're able to put midwives in a leadership position where they can influence policy, as I earlier said, but also they be able to contribute to tackle issues where they demand for the services that they need in country. Yeah.
Thank you. I think you're so right that, you know, just even getting nursing and midwifery is an important first step. And then that step to how do you actually separate the two professions so that you do have that voice for midwives. So thank you for that. And Franka, I want to turn to you now because you're coming from a experience where in fact nursing and midwifery haven't been combined. And I wonder what you think about midwifery leadership and how does it play out for you, both in the Netherlands and also what you see globally?
Thanks, Sally. I think when it comes to the Netherlands, indeed, midwifery and nursing are totally two different professions. But we do still have a lot to learn, I think, from other countries that are pushing midwifery forward. I think midwives in the Netherlands are autonomous. Midwives in the Netherlands make their own decisions. We are still to reach an academic level. Midwives are trained to bachelor degree, but we can move into universities. That's something that will happen in the future. And I do hope that also in the Netherlands, we'll have a chief midwife in a high position at the Ministry of Health so that we're able to influence maternity care in that way. And so we have many things to learn still in the Netherlands too. Just for us to realize that even though the Netherlands is at times seen as the place where you have autonomous midwifery and women have the right to the choice of birthplace, still we too have things to learn. I think your other question was about
just how you see midwifery leadership globally. Like, what does midwifery leadership mean to you when you hear that word or those words?
I think midwifery leadership is everywhere. I think that's what's really important. We mustn't think that midwifery leadership is those that are in top positions leading. We all lead, and I think midwives have many, many transferable skills. So we have the skill of being patient, being brave. We have many social skills. We are humble, we're proactive. We have academic skills. And I think all these skills are the types of skills that should help us to lead wherever we are. So we lead well when we're at a birth, we lead in our health clinics, we lead in our regions, we speak up for midwifery, and we do that in such a way where we listen to others and play our part. And then also, when of course we move to a higher level, and I think that we all need to remember that we are all leading and no one is not in a leading position. We need to lead wherever we are. And then of course also lead when you're in certain positions when you can influence nationally. But you can't get national leadership if you don't have a leading style attitude right on the ground with women.
Thank you, Franka. And Jacqueline, can I come to you? I'm sure you probably agree that everybody is a leader. And I wonder if in your experience, how you think that we can actually help midwives to understand this in themselves as leaders.
Thank you. I think that there is so many things that I could say, and I first of all have to endorse the narrative from my amazing colleagues. I agree 100% with what Aya and Franka has said, and I think we're a part of such a privileged profession. It's such an honour to actually call oneself midwife, and I do believe that we have an approach of servitude, I think, for women and their families and for each other. So stepping into that space of each other and thinking about we inspire and encourage other midwives to wear that jacket of leadership. There are so many things. I think from an undergraduate perspective, when students are in education and learning how to be midwives, regardless of the country, there is something about that drip effect of that autonomy that you grow into and develop that really sets the foundations for good leadership. So I think undergraduate programs have a significant contribution to make, particularly in the last 6 months or a year, if we're fortunate enough in some countries to have programs that have longevity in terms of a 3-year program or an 18-month program, but there is something about, as that student gets toward qualification, really helping them to look through their midwifery career through the lens of a leader and helping them to recognize what that means. But also, once a student graduates then and starts to learn their skills and competencies, that nervousness, that, you know, all that anxiety that we've all been through as new graduates, there is something again about how they lead. And my colleagues have said it all, but I do think that mentors during the preceptorship period, coach, if you're a coach, if you're in a position of leadership, we owe it to ourselves to have a look at those that are coming up, that are graduating today, that are thinking about joining the profession, and they're at school or at high school or college or whatever you call it in your respective countries. People that are thinking about being midwives, wouldn't it just be amazing if we demonstrated to them the strength of leadership and what leaders can do to truly advocate for mums, babies and their families? So my colleagues shared so many things, and I'm just really putting the icing on the cake, but I do think that it starts from the undergraduates.
Thank you. I mean, I think you're so right. I mean, in terms of our profession, if we are a nurturing profession and we nurture those students and those new graduates and each other, we're actually also exemplifying leadership through our careers, and that flows through, as you say. It's a very important foundation. Giorgia, I'm hoping that you've got your Interprify working and that you can understand what I'm saying. And I want to thank you.
Sí.
Great.
Sí.
I want to come to you and ask you why you think it's important for midwives to hold leadership positions such as yours, and just tell us a little bit about how leadership works in Chile, across the midwives in Chile and in South America, if you can.
Bueno, es importante poder ser líder donde tú estás, porque con eso nosotros podemos conducir los objetivos hacia los que nosotros queremos llegar. ¿Ya? Nosotros en este caso tenemos que ver con todo lo que es la salud sexual reproductiva de la mujer, familia, recién nacido. Y somos agentes de cambio, de transformación. Por lo tanto, somos capaces de llevar un equipo adelante. Ya nosotros acá en Chile, si bien la matronería hasta ahora ha como tomado fuerza, siento de que tenemos que cada día vamos ampliando nuestra expertise en la gestión, en la administración, ¿ya? Y en los cuales podemos ir participando cada día en la implementación de las políticas públicas. Yo creo que también es importante que esto se vaya homologando a todos los otros países, sobre todo en Latinoamérica, que tenemos muy buenos indicadores también en todo lo que es la mortalidad materna perinatal.
Thank you, Giorgia. And can I just congratulate you on your new position? It's very exciting for the global midwifery profession. Oh, I'm hearing myself now. For us to have a third chief midwife that we know of, as I said. So it's fantastic. Thank you for that. Congratulations, and look at you, so young and gorgeous. I'm going to change the order around a little bit, and Franka, I want to come to you and just ask you about how you've got yourself to the table. I mean, we talk about this a lot, don't we? That midwives need to be at the table where decisions are made, and we need midwives there to speak for midwives, to speak for women, to speak for maternity services. And it's not that easy to get to the table. And I want to ask you, in terms of your experiences and your role, what are the things that get you to the table? And when you're there, what do you do as a leader?
Thanks, Sally. Well, that's about my personal journey. And I do think that what we first need to realize is that everyone has their own personal journey and finds their own doors. And I think the thing is that when you see a door, open it, have the guts and go for it. I think in many ways I was born in a privileged position. And so I had an education as a girl. I think that's something that's really important. My parents saw education to be an important thing. I think that was really a big way forward. My parents believed that I needed to be autonomous financially. It's quite interesting. It was very important for them that their girls were autonomous financially. And I was brought up in that atmosphere of that was important. I've never, ever thought that I could be dependent on anyone else. So that was my drive as a child. I came into midwifery in my early 20s, and it was very much a life-changing experience for me because I suddenly saw something that really connected me to why I thought I was alive. It really, I believe in midwifery in such a strong way. I really believe that midwives, we are one of the few healthcare professionals that are true healthcare professionals because we are about health. And I think the community it's something that really inspired me. So I was able to take the inspiration and use that inspiration for my energy. I think I was also able to ask for help quite well. I do think that's very, very important that we work with others. I didn't do it alone. I had friends around me, I had midwives around me that told me I could do it. And I had friends of midwives because it's not only midwives, we are part of the world. So that was it. I think when it comes to doing the ICM work, it was also a matter of just jumping in at the deep end and thinking that I could do it. Because in many ways, I was quite scared as well. I know you know this story personally, but just before I was chosen as ICM president, I was really worried that I would not be chosen. I was even more worried that I would be chosen, because then you have to start doing it and you have to start speaking up. One thing which I think helped me most in speaking up is to believe in what I said and just to speak up and say it. Speak up and say and not be scared. I think when you're fearful and when you're scared, somehow you don't come across. And I feel that in many ways, those who don't agree with me, in many ways respect me more for the fact that they know where I stand. And I'm very able to have very good discussions with obstetricians, pediatricians, anyone really, because I stand where I stand and they know that. So I feel that they trust me. And I feel that they know that I just stand where I stand and this is what I believe in. And in some ways I can see that they respect that. So I would say to anyone, and I can see Jacqueline also nodding her head, having the guts just to speak up and say what you believe in, also listening that other people might have another opinion. But speaking up for what you believe in and going for it, I think is in many ways what you need to do once you're at that table.
Thank you, Franka. Iya, what about Aya? I'm sure I'm saying that wrong there. Aya. I'm so sorry. It's my New Zealand view on things and how we say things. Tell us about your journey to leadership, or the role that you're in now, and how you are getting yourself to the table in Malawi, and when you're there, how are you presenting yourself as a midwife leader?
So I would like to agree with Franka here that training background as a midwife, as a nurse, that also facilitated my growth in the profession. However, where I come from, Africa, Malawi, third world country, there are a lot of challenges for a girl child to grow into being able to speak out. So even I myself here, it was quite a challenge for me to learn to speak out, to be able to communicate, to be able to link and collaborate and network with my colleagues. However, I had support from classmates, colleagues in the profession, where I've also been able to interact with high-level people. And some of my lectures in college, I can remember Professor Adres Malata, I can remember Dr. Kazemba, I can remember Regina Solomba as some of the people that contributed to me being able to come out of my shell and be able to speak out. At the moment, the job that I have to learn to collaborate and network. And that sort of like pushes me to be able to link with people, to be able to communicate, to be able to, just network properly, to be able to engage with them, to bring out several other issues. So yeah, apart from the training, apart from having that support system, the position itself, because I am a programs and advocacy manager, it entails that I need to go out there and just throw myself in and just get it done and, engage with people, all sorts of people. And I think that's how I've been able to come out to and be able to be at that platform where I can make such certain decisions, I can add to issues that are happening in country. So that's what I can say about myself.
Thank you for that. And Giorgia, can I ask you the same? Can you tell us a little bit about your journey, how you, I'm sure you've been a midwife leader as everybody has been for some time, but now you're in a new role. So how are you getting yourself to the table? And when you're there, what's it like? How are you presenting yourself as a midwife? I think you're muted. Just need to unmute.
Ahí sí. Ahí sí. Bueno, en verdad todo mi camino que yo he llegado hasta este puesto, en verdad ha sido porque desde que inicié mi recorrido como matrona, bueno, yo inicié todo este tema en base a que tenía una tía que estudió matronería y ella me formó en el lineamiento de cómo ser matrona. ¿Ya? Siempre me instó a capacitarme, sobre todo en el área de la gestión y de la administración. O sea, para poder llegar a estos puestos, como dijo Franka o como dijo ella, es súper importante el poder capacitarnos, ya tanto en el ámbito clínico como en el área de la gestión. Sin esto, uno igual no logra estar en este tipo de puestos. Igual yo tengo que agradecer que vengo de un hospital que la maternidad es una maternidad más grande acá del país, en Chile. Nosotros teníamos muchos partos, tenemos muchas pacientes, por lo tanto, esa capacidad para yo poder tomar y resolver conflictos o poder resolver procesos clínicos, ya me amplió la mirada y la mirada crítica para poder yo hacerme cargo tanto del personal, de la parte operativa, el estar, como dijo Franka, teniendo un poder de decisión o una voz a donde tú estás en tu trabajo. Actualmente yo creo que aparte de tus capacidades, sin tener el apoyo de tus pares, ya es imposible poder lograr tener un liderazgo positivo, porque tú requieres de tener un equipo para poder entregar los lineamientos claros que tú como directora o jefa de matronería quieres instaurar en tu país. Creo que es súper importante el trabajo en equipo. Para mí creo que eso es lo más, es el puntapié para poder iniciar cualquier tipo de dirección o jefatura. Sin tus pares y no logramos mucho. Creo que uno tiene que ser validada entre tus pares. Eso.
Thank you, Giorgia. It's so fascinating what you're all saying, and particularly you've just said this, Giorgia, about your experiences as a midwife and the knowing that as a midwife, practicing midwife, the decisions that you make the care that you're giving to women has helped you to develop the confidence to actually, be a leader in other contexts. And I think that's very true. So thank you for that. And Jacqueline, I wonder, do you see things in a similar way, or could you tell us a bit about your journey, your different experiences of leadership, and how you manage at the table?
Thank you. I think that there are many experiences that help to influence your ability. So one could lean on the academic side of becoming well educated in terms of a higher level degree and a PhD and further studies. But there is something about that lived experience of feeling, being and knowing that helps you then with your purpose. And I have a sense of purpose for doing everything that I can on my watch, as I call it. And I think for all of us, wherever we are in the world, this is our time, and we have to make our time count. So I have a sense of purpose, and my purpose is very often fueled by a sense of urgency, and that can be a double-edged sword at times. So my journey in terms of being a clinical midwife, I still maintain clinical practice to this day. I think it's important for my authentic narrative when I'm speaking truth to power and somebody has an opposing view. It's always helpful to call on your clinical experience and the experience of women and their families and your colleagues. So the clinical experience, my education experience of managing and leading education, undergraduate and postgraduate studies, my experience as a consultant midwife, my experience as a head director of midwifery, and all the other things that I did in between, some of the health promotion side, psychological side, caseloading women who were pregnant as a result of rape, and all the, if I look at my journey, I believe that every single thing that I have done contributes to the leader that I am today. And I think for anybody listening, never think that your experience isn't valid, whatever the experience is. Even if you have the privilege of sitting with a woman and listening to her birth story, that is an experience that can influence you as a leader, because certainly the roles that I've undertaken have influenced me in terms of my experience, the lens that I look through when I'm speaking and advising and advocating. But the sense of urgency and purpose is always with me for this time, for our time, because it's a precious time and we have much to do to have our profession recognised for what it should be recognised to be. And as the Chief Midwifery Officer in England, I have this vision and this dream that one day, when people think midwife, they will automatically think improves outcomes and experiences. And for other parts of the world, when people think midwife, save life. That's what I'd like. That's the, I don't want to hear midwife delivers a baby, midwife supports breastfeeding. I really want to align what we do to the evidence, the empirical evidence that says if you have a midwife, you improve outcomes, experiences, and in some parts of the world, you save lives. So in my leadership, I have a sense of urgency and purpose for ensuring that we change the narrative right now for our people that we serve.
Oh, that's brilliant. And I can see all these nods and in agreement from your fellow panelists here. I'm wondering, is there something, I mean, you've all spoken about, drawing on your experiences and how you've built your confidence, speaking up, having a passion, something is driving you. So you can't just ignore it. You can't walk past, you have to actually act. which is probably what takes most of us into sort of leadership without even necessarily intending it. Taking opportunities, Franka talked about asking for help, working together. But I wonder if there's anything that you think is particular about the way in which midwives lead, or the sorts of skills that that we see in women's leadership and midwives' leadership that's maybe different to the kind of experiences of leadership that we might have seen from men, or in our more traditional systems of power and leadership. And can I come back to you, Giorgia, to kick this off? What do you think?
Mira, yo creo que para poder estar en este ámbito de la matronería, ¿ya? Hay varias cosas que a nosotros nos ayudan para empoderarnos, ¿ya? Entre esos, el que nosotros, como yo les contaba, la capacitación para mí es un ámbito fundamental, ¿ya? El trabajo en equipo que nosotros podemos establecer entre las asociaciones de los colegios, por ejemplo, ya que en mi caso también el poder posicionarnos dentro del país fue un gran apoyo, ya porque ellos fueron especialmente las que impulsaron, según los lineamientos de la OMS o OPS, que ayudaran al fortalecimiento de nuestra profesión. Además de, como bien decían, yo creo que parte importante también es evaluar desde la formación de pregrado, ya todo lo que corresponde a liderazgo, gestión, y así empoderándonos desde pregrado. A veces nos falta un poco este empoderamiento, ¿ya? Y como tú dices, nos enfocamos netamente como a la parte clínica y dejamos un poco de lado la formación en este ámbito, porque como inicialmente dije, yo creo que nosotros somos actores de cambio. Podemos apoyar todo lo que es el trabajo con la mujer, ya desde todo el ámbito de su ciclo vital. Por lo tanto, para nosotros yo creo que hay que empezar a fortalecernos, el demostrar lo capaces que nosotros somos en tomar la lucha en defensa de la mujer. Entonces, efectivamente, yo creo que hay muchas trabajo que nosotros debemos hacer y tener esta experiencia de contar qué es lo que tú haces en los diferentes países. Yo creo que nos ayuda puntualmente a poder tomar la decisión y llevarla a todo lo que es gobierno, yo creo. Para mí eso yo creo que es una de las cosas más importantes que yo creo que hay que empezar a hacer, es empezar a visibilizarnos como un ente que no solamente atiende partos, sino que efectivamente nosotros estamos en todo el ciclo vital de la mujer, sobre todo ahora que la lucha en la parte sexual, reproductiva, ha sido muy ardua y están en todos los países las mujeres tratando de establecer que la importancia que ellas tienen, o que tenemos en realidad, incorporándome a la mujer, porque creo que nosotros somos capaces de poder hacer muchas propuestas, proyectos en relación a la temática de mujer.
Thank you, Giorgia. Iya, do you think that there's any particular way that midwives lead, or that women lead, that's different?
Yeah, there is a particular way that midwives lead, and it's important to know that they're quite caring in a way, that they midwives need to be able to assert themselves out there, but they cannot do that if they don't have the necessary, if they haven't been empowered to be able to take up issues at that higher level. So what I see with a lot of midwives is their inability to communicate properly, especially in my country, in Malawi. You see a lot of them sitting back and watching, whilst a few are able to stand out and speak out and demand for services that they want, resources that they need. So for us in Malawi, I think it needs to start at the grassroots in the way that we are trained in college, in the way that we empowered, not that to specifically look at the service delivery part, but also learn how to lead. So for midwives in Malawi, they need those skills in them, but they cannot get that just by sitting and watching from the back, but they need to be able to go out there, be proactive, be adventurous, link up with several other professionals, learn how to communicate, and learn how to just be able to collaborate and network and engage in the right way, in the right manner. So yeah, they need to be adventurous. They need to stop, they never need to stop learning. They need to continue learning even further. There are different platforms that they can join, not specifically to be midwifery profession platforms, no. But for example, Toastmaster, that teaches how to communicate in a diplomatic manner. So midwives need to go out there and learn and advance their portfolio of skills, and not just to stick to the midwifery profession itself. Yeah.
Thank you very much. Yeah, I think how we encourage people to not just sit on the sidelines and watch. You know, how do we get people to midwives to act, to step forward, to not let things go past them. I think that it's a very big challenge, and important that we do encourage each other to do that. Jacqueline, what do you think? Do you think there's a particular way that you see midwives leading in terms of their skills or their approach to leadership?
I think I agree with what colleagues have said so far. I think that midwives are leading in a climate that is quite challenging, when everybody thinks that their portfolio is significant and important, and they are. But the unique thing about midwifery leadership is what we do for our people, for childbearing women, ripples through the generations, and that's the fundamental difference. We can, from the environment in the womb, through education and health promotion, influence the life course, can influence adult health. So what we do ripples for generations, and I think when we're leading, to sow those seeds from, as I said, the undergraduates all the way through to middle managers, what we do is so significant, because this is about generational change. So of course we're unique, but I started out by saying that it is quite a challenge and a struggle when you are sharing your narrative and everybody else's narrative sounds to be of equal significance. But we are leading our profession, and we are leading, caring, managing, facilitating, empowering, educating for generational change, health change. So that's pretty unique. I don't think I've answered any more of your question, but I do believe that we are unique because of that contribution.
Yeah, I couldn't agree more. I mean, the impact of the midwife on not just on the woman and her family and that birth experience, but all of her sisters and cousins and aunts and friends, and how we actually influence right out into society and across generations, as you say. I think it's an amazing opportunity that midwives have to influence, you know, for the better. Thank you for bringing that one up. Franka, I'm going to come to you and ask you whether you've got thoughts about the particular way that midwives might lead that could be different perhaps to what we see in male leadership.
Well, I think that I see midwives lead well when we lift each other. And it's actually something that I learned really well through Jacqueline, a conversation with Jacqueline that I had. You know, sometimes a moment that you click about something, it's something you said, Jacqueline, a year ago when I was with you at the conference, about the way that you are making sure that those midwives that are working with you are put into top positions and also have a salary that reflects their level, and how important it is to do that, because it gives others around them, it gives them the status that they need. So you understand your context and you lift people forwards. And I do think that when midwives lift other midwives, we really do make a huge difference. And I think lifting each other in that way is quite, I think in patriarchal leadership, you see that less often. You try to get to the top, but if we are able to do that, we do really well. I agree, at times we don't find it easy. I think that, you know, with midwifery globally we have the wind in our back in many ways. You know, research is totally supporting us in many ways. And I think because of that, we can feel that we are more able to take the power. And when we take the power, we times fight for it. So I'm sure that you recognize, Sally, you know, we've had conversations with countries where midwives with different opinions at times don't lift each other, but instead of that, argue with each other. But if we are able to understand this, as Jacqueline said, why we're here to stand with women and families. We're here to make the difference. We're not here for ourselves. And I think realizing that we are not here for ourselves is really strong leadership. That's not weak, that's strong. And lifting others. And so if, for example, in the Netherlands, you see that midwives in the clinic and midwives in home birth at times have some issues with each other because one feels that the other doesn't understand the other. But if those two midwives would actually lift each other, if midwives that do home births would say, look, isn't it fantastic that we have midwives in hospitals? And midwives in hospitals say, look, isn't it great that we have these community midwives doing home births? That type of leadership where we lift each other, that will lift midwifery. And I think we can all do that in our daily work. We can practice it every day personally, and it will make a difference. And I think that is something that is special about how we could work. We don't always do it, but we do have the ability. And when we do it, it works.
Thank you, Franka. I can see I can't really read the chat while I'm listening to you all, but I do see a lot of agreements coming through to things that everybody is saying here. So I think our participants are agreeing a lot with what you're saying. And I'm very conscious that I'm kind of, you know, leading the questions here. And I just wanted to give you all a chance to maybe ask each other a question if there was something, and also please, you know, do feel free to kind of stick your hand up and chip in if you would like to. But is there anything that you specifically would like to ask somebody else on the panel? And Giorgia, can I start with you? Do you have anything that you would want to ask, or just ask to find out what your fellow panelists think about something? Feel free to do that.
Me gustaría preguntarle a Franka, ¿cómo podríamos lograr que este modelo de liderazgo que tenemos nosotros como matronas pueda visualizarse y con no tanto trabajo? Porque en nosotros como matronas siempre tenemos que ir trabajando con mucho corazón y para ir poder cumpliendo todos los desafíos. Entonces, la pregunta es, ¿qué nos estaría faltando a nosotras, ya en ella, en este momento como líder de la matronería, para que el resto de los países pudiéramos obtener también puestos de liderazgo y que nos valoricen con la importancia que nosotros tenemos como matronas?
that's quite a question.
Franka.
Thank you for that question. Well, actually, I think it was it Jacqueline who was talking about students. I think we need to start with our students, and I think we need to start with realizing that we have to lead wherever we are. I don't think it's a matter of saying that we need to have leaders in the top positions. We need to start leading where we are and dare to speak up and be humble and compassionate to the team and the people around us. Walk the talk, which is difficult, especially when you feel that you might not be heard, when you feel you have to struggle. At times that's hard, but I think keeping ourselves humble, understanding why we're here, and I do think that helping our students, lifting our students and helping our students to understand what leadership means, maybe integrating it more into their curriculum, what leadership is, how important leadership is, and also lifting them through their career. At times our students have a hard time, and we could help them as people who are in other positions to get them through that beginning time. I do think that is one way we could do it. And I think on top of that, we need to recognize the context of every country. You became a chief midwife in a different way than Jacqueline did. And I know that in Sweden, they're looking to find a chief midwife. In Germany, they're looking to find a chief midwife. And I know in the Netherlands, they want to go for a chief midwife. And everywhere, we will find a different door, a different way of doing that. So recognizing that, understanding that, and supporting each other, and being patient, which is a skill that midwives have. We are extremely patient people when we're with women, standing with women. So we are patient, and we need to go step by step. And at the same time be impatient, or at least not tolerant of not getting there. So those two at the same time, I think will get us there, and support each other like we're doing now. We're getting together and we're hearing each other and we're inspiring each other. It's like, polishing each other's souls that you can move forward and feel inspired. But I'm sure the others have something better to say than I do.
No. Polishing each other's souls is pretty good, I thought. Jacqueline, do you have any questions for anybody on the panel?
Thank you, Sally. I have one for you.
Yeah.
And I don't know whether I'm allowed to ask you a question as the chair.
Why not?
but I just wondered how you cope with managing expectations of a global people looking to the ICM. I guess it's both you and Franka really, but I just wondered how you manage that sense of responsibility.
Yes, well, I think that I'm sure Franka agrees. I mean, it does sometimes weigh heavy in a way, because there's so much to do, for one thing. And I guess we have very high expectations of ourselves. Perhaps the highest expectations are from us, not from others. And so I think, you have to kind of realize that, and realize that that we are all doing this together. So this isn't just ICM doing something that's going to save the world. This can only ever happen if, what you talked about, that vision that I think we all want to see achieved, that woman has the absolute best outcomes that she can possibly have, and her baby. That vision can only be achieved through all of the world's midwives doing their absolute best and being supported by their associations, and by their associations being the voices in their country to step up and stand up for midwives and for women, to get themselves to the decision-making table, to constantly advocate for what needs to happen in their countries, because we don't know that and can't say that at ICM. We can only help and provide tools and guidance, but at the end of the day, it's the midwives associations, our members, who are the ones that actually are going to be making the most significant change. And I think it's a long road. So I think also, we keep going and we don't give up, because change is sometimes slow, and sometimes you think you've got somewhere. I mean, I come from New Zealand. We thought we'd got somewhere when midwifery, you know, autonomy was reinstated in 1990. And we didn't know that there was going to be another 30 years ahead of us of actually getting that system really deeply in place. And even then, it's vulnerable. So you never actually reach the place you're heading to. You just are taking steps on the way. And I think, you know, the thing is we just have to do it together, and we keep supporting each other, as Franka says, and keep our vision and keep saying what we need and what our expectations are, but also our expectations of others. You know, how are they going to help us then? You know, if they have expectations of us, well, what are they going to do to help us to get there? So that's what how I would answer that.
Thank you.
Yeah, do you have a question for anybody?
Yeah, mine is towards to you as well, Sally. I'm interested in how you're working with the associations in your country to try to put them together to set agendas, advocate for them to be able to empower the midwifery profession in your country. How are you doing that?
Well, in my country, or you mean how is ICM doing it with its midwives associations in various countries? Perhaps.
Yes.
Yeah. Maybe I could turn that back to Franka.
That's not fair.
Go on.
Well, you know, I do think, Sally, what you said earlier, that we, ICM, I think what we need to understand is that we are ICM, all ICM. And so we are all the different midwifery associations, 143 of them worldwide, that is we. And I think we really need to remember that is we. Because if we remember that we also feel that the action needs to come from us, not from ICM head office, but from all of us. I do believe that joining a midwifery association, all midwives joining a midwifery association and speaking as one is so powerful, and we cannot underestimate it. And I think if anyone is here that's not part of midwifery association, or maybe you feel, oh, I don't want to be part of the midwifery association because they don't do or say what I believe, then join the association and start helping them to do what you believe. Because I think that is the one way in which we can make ourselves strong. And I do think that, I mean, kind of going on to a question to Jacqueline, you know, Jacqueline, how you found the door to becoming the Chief Midwifery Officer. I think that you found your own unique way of getting there, but I do think Midwifery Association also had a role in that. Could you kind of explain what were the different, what do you think were the most important aspects that were at play at the time when that decision was made? Because I know it's a long process, but what happened whereby it became real?
I think you're absolutely right, Franka, in saying that midwifery associations played a part in where we are today in England. You know, there is always a first, there's always somebody that helps to turn the tide, that helps to move the momentum along. There are so many firsts, and the firsts create that ripple for people like me. So, you know, the ground was already fertile. I think, you know, we had the demise of statutory supervision in the UK, which was really, really challenging. But when one door closes, there is an opportunity to ask very senior people, what are we going to do for this significant leadership? And I think, you know, we haven't spoken about people who are in key positions, our allies. We haven't spoken about allies, but it's really helpful to know who our allies are, not be shy in terms of liaising and corresponding with people in very senior positions, because our profession is very significant and very important. So it should be on that very senior table. I don't think anybody should shy away from moving that momentum forward, so that our profession is being discussed in the most senior circles. So we had the demise of statutory supervision. that there were allies in the system. One of them is Deputy Chief Midwifery Officer Jess Reed, who worked really, really hard on looking at system leadership in England, midwifery leadership in particular. There were many doors that were knocked on. There were many doors that were opened, positions in power, knowing who the key people were at a government level. And never, you know, you mentioned the word courage, Franka, earlier, having the courage and having the purpose and the sense of urgency that I talk about to keep moving forward, taking the agenda forward, being wise with the allies, being wise with the agenda, being wise with the evidence. We have good empirical evidence about who we are and what we do, and all that together culminated in the right door being knocked on, the right door opening, and the appetite and interest. But I do think, you know, Jess Reed, my deputy, frequently talks about changing the narrative. You know, we must think really in a very clever way about how we change the narrative. And that's why I have a vision I mentioned earlier that I want, when people think about midwife, they think about improved outcomes for mums and babies. So changing the narrative. And once I became Chief Midwifery Officer, I then set about the task of building an infrastructure for England, so that I had my eye on that person thinking about being a midwife. I had my eye on the undergraduates that are soon to be qualifying. And I looked back metaphorically and thought, I need to build this infrastructure going forward. So we have 2 deputy chief midwifery officers and 7 regional chief midwives. So there is a chief midwife in each region. For those globally, we have 7 regions in England. England is carved into regions. And we have a chief midwife in each region. Now, to get that infrastructure of 10 people with chief in the title and appropriate salaries didn't come by not being, as Franka says, Franka mentioned being courageous. That didn't come by shying away. That didn't come by thinking, I'm only a midwife. That didn't come by thinking, I need to use the back door. That came by knocking on the right door and standing up for our profession and who we are, knowing that we have to safeguard for those ones that are graduating today and for those that are thinking about being midwives tomorrow. So I'll stop there. There's many stories behind all those stories, but I think, you know, Franka, courage is really, really important.
Thank you, Jacqueline. I think it's courage, and it's also actually having a plan, as you say, actually knowing what you're trying to achieve and working out who are all the people that you're going to have to influence to get that to happen. And you know, I know there's a lot of people on this webinar from associations who are starting this journey of getting towards getting a chief midwife in place. Because of the importance of the principle of having a midwife at that highest level, next to that chief medical officer, next to that chief nursing officer, you know, the chief midwife officer. It says something about what a country and a government thinks about midwives when they have those positions. And that's what we're, you know, of course, trying to influence. And Giorgia, I wonder if I could ask you again, you know, in terms of Chile, what was the pathway to getting you in your role? You're a first as the chief midwife in Chile. What role did your association have? What kind of plan was there to get your position in place? And what were some of the obstacles that had to be overcome along the way?
Bueno, nuestro camino desde el liderazgo empezó en el año o sea, se concretó el 2012, pero esto viene desde antes, cuando el Colegio de Matronas, la asociación gremial de acá en nuestro país, logró instaurar la norma 21, que nosotros llamamos acá en Chile, que es un modelo de atención de liderazgo de matrona en los diferentes hospitales de Chile de alta complejidad. Con eso nosotros logramos poder instalarnos con diferentes líderes ya a diferentes escalas en nuestro país. Acá nosotros tenemos supervisoras, coordinadoras y las gestoras que están a cargo a nivel hospitalario, por ejemplo, de todo lo que es la maternidad. Ese fue, yo creo, nuestro primer logro que nosotros tuvimos acá en Chile y que nos hizo visibilizarnos como matronas, ya como matronas en un camino de empoderamiento. El Colegio de Matronas hizo un enorme esfuerzo ya en seguir este camino, en poder tomar lo que los lineamientos que decían en relación al fortalecimiento de la matrona en lo que decía OPS y OMS. Ya hizo un camino arduo para convencer a nuestros líderes acá del Ministerio de Salud, ya de la importancia que nosotros podíamos tener estando en este puesto. Para mí ha sido un camino muy, muy interesante, es un desafío. Siento que yo venía de un hospital que estaba netamente evaluando todos los días la parte operativa, pero desde acá, desde el ministerio, uno tiene la chance de poder entregar y aportar todos los conocimientos que uno o las brechas que uno vio en la parte operativa. Siento que ha sido muy importante la validación que el ministro de Salud nos hizo en este cargo. Creo que es súper importante que el camino a recorrer, ya, y con esta valentía que todos como decía Jacqueline, con la fuerza, ya, en poder que los ministros de salud sepan que nosotros podemos entregar mucho a nuestro país. Y no solamente en el ámbito de la matronería, creo que nosotros somos capaces y tenemos las competencias y la expertise para poder entregar asesoramientos, por ejemplo, a nivel de la salud en general. Entonces, yo creo que eso ha sido un camino que se agradece a las asociaciones que estuvieron en este planteamiento, creyeron en que nosotros sí como país podíamos estar liderando. Ya, acá nosotros tenemos varias complicaciones, entre esas un poco en el tema de recursos humanos, que efectivamente no hay muchos recursos económicos para poder posicionar más matronas. Ya tratamos con la evidencia que hay, ya poder exigir que se puedan poner a diferentes matronas en los diferentes puestos que están faltando según vaya avanzando la salud con su epidemiología, porque cada vez nosotros, por lo menos acá en Chile, tenemos mujeres que están muy complejas en su salud. Son mujeres que el 60% tiene patologías crónicas, por lo tanto también eso dentro de los lineamientos que nosotros debemos tener es especializarnos en algunos tipos de patología. Entonces, yo creo que es súper importante la validación que te da el Ministerio de Salud para poder continuar este camino. Y por otro lado, yo siento que también existen poco compañerismo entre las profesiones que están en nuestro país. Yo creo que muchas veces nos olvidamos que la salud es una, que la mujer es una y que debemos trabajar en conjunto y no tenemos que estar tratando de invisibilizar a la una o a la otra. Yo creo que lo más importante de esto es ser generoso en este camino, nosotros tenemos que trabajar en equipo tanto interdisciplinario como también con nosotros como matrona, como dijo Franka, hay que elevar a la matrona en este momento. La matrona tiene todas las competencias para poder salir adelante, tener la voz que, de lo que ella puede lograr en conjunto con la mujer. Eso, gracias.
Sally, could I make a very short comment to that? Because something is really, I'm really noticing about what both Jacqueline and Giorgia and Aya are saying.
As I find very short, you can make it.
Sorry, I'm so sorry. It's actually something I learned from Oni, who's also here. I'm one of the people that's advisors on communication. In the lots of people are asking, you know, we're having difficulties in our country, how can you help us? And what I'm hearing Jacqueline say, and also Giorgia and also Aya, is that we're not presenting ourselves, we're not presenting the problem, we're presenting the solution. And I think as leaders, what we need to do is to show that we are the solution, not be there and say, oh, poor us, midwives, we're having it so hard. No, saying we are the solution to your problems. Yeah. And that is the way forward. Sorry.
No, it's a very, very good summary, Franka. And I think, you know, I've noticed in the chat as well, people acknowledging or the need to using research evidence and changing the narrative through, you know, actually being able to show that we are the solution. And Aya, I'm so sorry because I have to go to Q&A now. I'm getting the big nudge. But I was going to, because I wanted to ask you about our allies, as Jacqueline said, you know, the importance of working with allies, identifying who can help us. And I would suggest that women can help us a lot in women's groups, and that midwives associations can connect with women's groups in their communities. And together they have a much more powerful political voice to bring about change. But I didn't have time to explore that with you. And now I need to go to the questions and answers, which I'm just trying to find, Oni. Because you are scattered right through the whole thing. So I can't quite get you in one place.
Sally, you have a Q&A at the bottom. There's the chat and there's the Q&A. You need to go to the Q&A.
Okay, all right.
At the bottom.
So if it's answered, it won't be showing here because we were going to be doing it in the chat. So somebody's asking, could midwifery be influenced by the gender perspective where women are supposed to be seen and not heard in many societies? Can this be addressed through the lens of gender equity? And Aya, let me give that one to you. How much do you think midwifery is influenced by gender inequity, and how do we address that?
Thank you, Sally. So I'll give an example again of Malawi, where we have more nurses and midwives being female, yes, and few of them being male. And we've always seen over the past years how the male gender has advanced much further in the profession itself than the female gender. So it's quite interesting. Maybe it comes with the character of the male gender, where they are more confident, they have more self-esteem to express issues confidently in groupings, in public, than how we are raised as in the female gender. That's also, of course, related to the culture. So there needs to be, of course, really that gender equality, but I think it's time for my gender, the female gender, to come up and be able to have that self-esteem, be able to have that confidence to be able to express issues at that higher level. So we cannot say, let's now be equal in everything, when what you're able to offer on the table is not at par with your competitive at the other gender as well. So I'll just give an example of the current political situation in my country, where we have a new president, and in recent times it's just selected the new board. In those boards, the new boards in government, about 66 of them. In those boards, civil society organizations were able to come up and say, but we don't have an equal representation of the female in those boards. Can you do something about it? Because in your campaign, your manifesto, you say there'll be gender equality in all the boards, in all the statutory corporations, and in all other high level, even the ministerial positions, there'll be equal representation of the gender. And he was able to come back and say, but look, there are not as many as women who are able to assert themselves and present issues at that higher level. Most of them are sitting back and watching and letting men take over, sort out issues at that higher level. How would I then be able to choose women that are capable to be in such positions? Give me the names of the women that you see are capable to be in such a kind of a position, and I'll be able to include them. I promise you, I'll be able to include them. So I think it has to start with the change, the cultural change, as we raise up our kids, as we are training ourselves in the in the schools, various schools across the country and across the globe as well, that we need to empower the girl child to be able to come out and speak out and present herself. Just as Franka had said that growing up, she was, the parents were on the forefront trying to empower her to be able to fight for things, to be able to source resources for herself. She was empowered at that young age. I think we need to start to do that. So yeah, confidence is key, but how do we inculcate that confidence in our girl child to be able to come out and present themselves, to be able to talk about issues openly and confidently with full self-esteem? So yeah, that's what I can say about it. Yeah.
Thank you, Aya. That's incredibly important, isn't it? Starting with the girls and keeping going, keeping going. Franka, there's a question here that I'm going to give to you from Burkina Faso. What are the actions taken by ICM to promote the profession of the midwife in Africa? And if you could speak on that briefly. How we raise the profession, how we raise the visibility of midwives in Africa.
I think as ICM, and again, ICM is all our associations. So I think every single association is doing that. And at the moment as ICM, we are moving more towards the region. So we're trying to have regional board members speak for the region. We are trying to make sure that associations are strong enough to be able to speak for themselves and to show how important it is to have midwifery associations. And on top of that, of course, we set global standards and influence WHO and influence United Nations to see our global international standards. And these are also very important for Africa because we see governments seeing those international standards and taking them to their countries. So I think in that way we are influencing. One very practical way in which we might be or hope to be influencing is that next year we'll be having a new State of the World Midwifery report coming out, where we'll be comparing all the different countries and the pathway of change in midwifery. And with that report, you will be able to show your country and how midwifery has grown in your country compared to countries next to you. We know that this report will be a really, really strong advocacy tool for you to show how important it is and what midwifery does and how midwives can make the difference. And so in these ways, we are doing that. But actually the data for this report is again coming from you. So you are already doing it. And I think standing strong with countries close to you, maybe twinning, matching and supporting each other to strengthen each other, to see which associations close to you have certain skills that you would like to learn and really recognize the skills you already have that you can share with others. And in that way too, you can strengthen each other. And as ICM, we're trying to profile that and give that attention. But we all have to play our part. I think that's the only way forward, that every single one of us plays our part. I hope that's answered it.
Yeah, thank you, Franka. Jacqueline, this is one I'm going to send to you. Can I please ask for tips on how to ensure leadership roles are inclusive and representative of the diversity within our profession? If you'd like to tackle that one.
Yes, I think that's a really good question. And I think, culturally, there needs to be, number one, acceptance that rich diversity can only add to improving healthcare. In fact, there's evidence that suggests that if your leadership is reflective of the people that you serve, if your teams are supportive of the people that you serve, then you are on the road toward improving healthcare and outcomes. I'm not quite sure where that country's where that question, which country,
which midwife actually, from the UK.
Sorry?
From the UK.
From the UK. Oh, okay. So I'm not quite sure in terms of where you are in the UK, but in England, to help to tackle this real significant challenge, we have something called the Workforce Race Equality Standards, where we abbreviate them as RES. And the Workforce Race Equality Standards mean that every NHS provider, all the NHS, regardless of whether you have a maternity service or not, but maternity will naturally benefit, every service has to adhere to these workforce race equality standards. And what they do, they ensure equity for staff. So they ensure equal opportunity for continuing professional development, equal opportunity for applications and applying and being in roles that are senior roles, and not just in roles that are very low paid and junior. And there are many, many more standards, but there are many, many more initiatives that are tucked within the RES standards, but they're all premised on equity. So they're the workforce race equality standards. Now, does a NHS provider in England have to adhere to those standards? Yes, they do. They have to submit their RES data. So how many Black, Asian, minority, ethnic people are represented at an exec level, for example? Where is the equity in terms of doing that master's degree, or indeed having equal chance to go off and be educated at a higher level? All that information, the 9 RES standards, are submitted in to the NHS England improvement, but also the RES standards are tucked within the Care Quality Commission, our regulator that ensures that we are providing safe care. And the RES standards are tucked within the well-led domain of the CQC, the Care Quality Commission's inspection regime. So is there wriggle room in terms of getting around RES? There'll always be wriggle room, but that is just one example from England about how we are trying to ensure equity for Black, Asian, minority and ethnic people. And there are many, many more initiatives. I could go on, but that's just one response. And for the person that asked that question, if you just have a look at the NHS England improvement website and type in RES, Workforce Race Equality Standard, you will get an awful lot more than what I've shared with you now.
Thank you, Jacqueline. And I think that the whole concept of actually having standards that need to be met by health services around equity is incredibly important, and that's something that could be taken on elsewhere as well. Look, there's several questions in here around midwives' roles in advocating for women during COVID-19, and women losing their rights, the sort of injustices that we know are happening around the world to women and babies. And I wonder if you, Giorgia, if you would be able to speak to that. Just tell us about in Chile and in South America, how midwives are trying to advocate for women around COVID-19.
Bueno, acá en Chile, en relación a COVID, nosotros nos hemos visto bien apaleados por esta pandemia. Ya, sin embargo, nosotros como matronería y matronas que estamos en el quehacer diario, hemos tratado de hacer defensa en lo que podamos. Nosotros igual tenemos sistema de salud medicalizado, ya en que nos cuesta un poco llegar a poder, en que las mujeres gestantes, en este caso, pudieran ingresar con sus, por ejemplo, con sus acompañantes. Ya muchas veces no nos acompañó un poco el tema de infraestructura acá en nuestro país. Pero sin embargo, por ejemplo, en el hospital donde yo hace un mes trabajaba, y nosotros fuimos una de las maternidades que más COVID en este momento tuvo, hicimos varias intervenciones que creo que cumplieron un poco en apoyar el camino de la maternidad. Ya nosotros igual mantuvimos todo lo que era el acompañamiento en parto. Se hizo apego en los bebés que en este momento no estaban con, bueno, ese contacto primario piel a piel, mejor dicho, que no estaban con... ¿cómo se llama?, con sospecha, ¿ya? Pero igual se nos hizo muy complejo este tema por un tema netamente de infraestructura. Sin embargo, yo creo que la matrona hizo valer en el ámbito médico y convenció de la importancia de estas dos temáticas, que era el mantener el acompañamiento y el contacto piel a piel. Se establecieron estrategias también a nivel país para mantener la continuidad de la atención en los diferentes niveles de salud, ya sea tanto en el ámbito primario, en el ámbito de entrega, por ejemplo, de métodos anticonceptivos. Nosotros acá tenemos además una ley que es la interrupción voluntaria del embarazo, también eso se mantuvo. Entonces todo eso fue con mucho trabajo de parte de las matronas en este país. Yo creo que nosotros hemos hecho un trabajo muy arduo en mantener los derechos de la mujer, unos más, otros menos, dependiendo de cómo se den las condiciones laborales también. Nuestro país es muy disímil, hay algunos que tienen muchos más recursos que otros, y yo creo que es ahí donde tenemos que enfocarnos en la parte de equidad. O sea, lo ideal, y yo creo que desde siempre, desde que nosotros salimos, desde la universidad, es que nosotros podamos defender a nuestras mujeres en el ámbito de la reproducción, de la sexualidad. Entonces, yo creo que en nuestro país hay un mundo por donde nosotros como matronas podemos mantener. El ámbito, yo creo que en este momento, la pandemia, lo que nos hizo ver es todo el trabajo que tenemos por delante, el disminuir la inequidad en los diferentes niveles, tanto privado como público. Yo creo que eso es lo más importante que nos hizo visibilizar la pandemia en nuestro país.
Thank you, Giorgia. I think your experience is common around the world, you know, that the COVID-19 pandemic has totally shed light on the inequities that existed and have been made worse, and opportunity that's been taken to almost to remove rights from women during childbirth and in their reproductive life. And I think we have real admiration for the midwives in South America, actually, because you're so passionate about standing up for women's rights. So we great respect to you and the work that you're doing. Unfortunately, I think we've come to the end. There's other questions that I'd love to be giving you, but I'm pretty sure we're on time, even though my clock's running slightly slower. And it's time to wrap up. I really want to thank our wonderful panelists, all four of you. You've been totally inspirational, and what a privilege to be able to listen to you today, and this amazing depth and wealth of knowledge and experience that you have shared with us. It's been really wonderful. So thank you all for giving up your time. Thank you to all the participants for coming, for participating in the chat, for your you know, obvious enthusiasm for the subject, for putting in your questions. We really appreciate it. And I guess I would just like to leave you with a couple of kind of pointers of things that I've picked up, and this is not a great total list, but just some things I've heard. So the need that we lift each other up, that we take opportunities, we have the guts to do something, we don't stand by. We nurture each other, we work collectively. We start leading from wherever we are. We are all leaders. We need to be humble, we need to be compassionate, we need to be brave, we need to listen, we need to understand our role and our purpose and keep that to the forefront. We can role model leadership, we can teach leadership in our pre-service programs, we can encourage our fellow midwives to lead. We work from our own contexts and we adapt to our own contexts. We need to identify and know our allies and build relationships with them. We need to go to the top and talk to those people that we need to talk to. Don't be fobbed off by the next person down who won't be able to make a decision. Go to the people that can make the decisions. We need to change the narrative that being a midwife is about improving outcomes for mothers and babies. It's essential. It has a ripple effect on the whole of community and society and across generations. We need to raise our visibility as midwives, and we need to present midwifery as a solution always in our arguments. So thank you all very, very much for your participation, and we look forward to seeing you at the next webinar in a few weeks' time, looking at the relationship between women and midwives. And again, thank you, and have a good evening or good morning or good night. Thank you.